Hello, I am Bec Marquis. I use she, her pronouns, and I am currently the Acting Youth Work Coordinator at Kingston Youth Services and also the lead worker for our queer social program called Pride Connect, which is for young people ages 18 to 25 in the Kingston area. We came in contact with the mental health coach as City of Kingston had some funding and we wanted to do some mental health first aid training. And so we reached out to Nick from the mental health coach to do some specific rainbow mental health first aid training. At Kingston Youth Services, we run 2 queer social groups for young LGBTQI+ young people. We have our younger program for 12 to 17-year-olds, which is called Queer in Kingston, which has been running for many, many years. And it used to be a group for all ages, but we decided to split the group, and now we have created a co-designed group called Pride Connect, and that is for our 18 to 25-year-olds, also a social group. Youth Services wanted to provide our young people with contextualised rainbow mental health first aid training to enable them to upskill in the areas of peer-to-peer education. But we also had workers and other council members join the training to have experience from the young people brought into the training by Nick, and so they could really contextualise the skills that we were learning in the young person's everyday life as rainbow young people. So, yeah. We wanted our training to be attended by the young people that are connected to our service, so people attending our Pride Connect program. And we also wanted other people from council, so we reached out to our youth services team, our libraries team, and our community connections team to make sure that the people who were really on the front line dealing with customers and young people across Kingston were equipped to deal with these mental health problems and had the training to do those things, When we're planning for rainbow events and programs at council, we are super careful about everything being safe, especially for our rainbow community. And so working with the mental health coach, they use an expressions of interest process. And so I felt really comfortable sharing information with the young people and knowing that they would be taken care of by Nick and the team. It also meant that they knew who were going to be the safe people they could talk to at the event, knowing that they were surrounded by allies and professionals that could help them with any problems that they had. The delivery of the program was really awesome. On the day of the training, we all felt very safe and heard by the facilitators. It was a really cool opportunity to connect with other areas of council who don't necessarily get to work with young people every day like we do as youth workers. But it was also really cool as a youth worker to see the young people connect with the other adults in the room and sharing their lived experiences as queer young people, but also finding out where they can access support in Kingston and the wider community as well. The feedback that we received from the young people who attended on the day has been awesome. All of them have mentioned how well the content was facilitated and how easy it was to understand. They've all mentioned being able to have those harder conversations with some friends and family since doing the training. And also they shared it with the rest of the group that didn't necessarily get to attend, and now they would like to do the training as well. Since the training, I think the biggest impact that we've had on our team is just having more conversations around mental health in the workplace, but especially how it impacts our rainbow young people and the groups that we run for them. We've made more of a priority on emphasising the safety of young people in our rainbow groups. And I also think it's really important that we're having these conversations with people outside of youth services, so aren't necessarily working directly with young people all the time, but just keeping their mental health and the impacts of their experiences as part of the queer community at the forefront of people's minds when we are talking to them, communicating with them, providing services for them, is the biggest impact that we've had on our team so far. If someone was considering running mental health first aid training in their workplace or their community, I would definitely recommend it, definitely do it. And if you have the opportunity to involve your community or young people that you run services for, definitely do that as well. It makes the perfect environment for connecting people, but also talking about lived experience and talking about being in the queer community. We would love the opportunity to work with the mental health coach again in the same or similar capacity. We definitely enjoyed connecting our young people to their services as well, and would recommend them to other people kind of looking for mental health first aid training as well. Talking about mental health problems can be a really scary or intimidating thing, especially if you are a young person. So being able to complete this training with the mental health coach has really improved people's confidence in being able to have those difficult conversations, especially on that peer-to-peer level for our young people, but also for our workers in the youth services.